Hello everyone, this is Dr. Bob DeMaria, and we're talking about no meds and heart health and blood pressure. And this individual happened to be a male. He had a large tummy or a large abdomen, and his blood pressure was 150 over 82, sitting, and standing was 159 over 88. When we look at the graph itself, there are body signals here that would indicate to me that he has some liver distress, and a part of our recommendations were products to help improve optimal liver function, at the same time losing weight, drinking water, and exercising, and even using a product that we use called aqueous magnesium chloride helps reduce blood pressure, stabilize it, and manage it to reduce the amount of stress to one's heart. This is Dr. Bob DeMaria.